Now, this is a modern aspect of pharmacology. This is a one modern aspect of pharmacology. And what is this? See the word. In the medical science, in biology, they offered, you can say the words, the terms which we can easily understood by breaking them. So pharmaco, as I said, has become the drugs, isn't it? It's a drugs. And genomics means something related with the genetics, or it is a genetics. Something related with genetics. Got it? No problem? Now, there is one very concrete concept, and that concept is about the one drug is fit for all. One drug is fit for all, and that's not entirely true. That's not entirely true. That one category of people who are taking one particular drug, they have the desirable side effect. They have not a side effect, they have a desirable effect. Fine. Now, let's talk about another category of drug. Suppose we have the two category of drug. We have the two category of people. Okay, category A and category B. Fine. Now, this both the category of people, so we are giving a one drug called as the codeine. Codeine. Codeine is a kind of prodrug. It's a kind of a prodrug or opioid analgesic. It's a opioid analgesic administered to a patient for relieving the pain. It either be the moderate or severe pain. Okay. So codeine will change into the morphine. When it's absorbed in the body, it goes to the liver, and in the liver there is the one enzyme. Okay, in the liver there is the one enzyme, and that enzyme, is called as CYP2D6. CYP2D6. Okay, so by the action of CYP2D6, this codeine change into the active form called as the morphine. Morphine. Okay, change into the morphine. So codeine, we take the codeine, and what it is, write it down. We have the discussion this again, but for a while we just write it down. It's an opioid analgesic. What it is? It is a opioid analgesic, means for the pain. Opioid analgesic, codeine. Now, by the action of CYP2D6, it's changed into the morphine. We administered this codeine into these two category of people. People A category and people B category. People A category will show the desired effect. Okay, they got relief from the, you can say, pain. They got relief from the patient. So they are basically in a happy mood. They are in a happy mood. Now, the category B, they have, you can say, a dangerous effect. Okay? They undergo the very dangerous effect. And that is called as the adverse effect of drug. Undesirable effect of drug. Fine? So it have the adverse effect, or we can say the side effect. Adverse effect, and this category of people A, it have the desired effect. Desired effect. Now, we have the another category as well, and that category is a C category. It's a neutral. By administration of this drug, it also take this drug, but it won't show any changes in this body. There's no any relief from the pain. There's no any relief from the pain. Okay? So this is the under category. He is neutral. Okay? Neutral. Now, why it's happening? Why it's happening? The same drug which we are going to administer in these 3 patients, but why they are not responding in the same way? Why this much changes? This much changes is due to the reason behind this different manifestation by using the same drug is that we know that in molecular level, our body is made up of from the different. We are basically designed according to our genetic machinery, according to our genetic setup. And then the set of that gene is called as the genome. Genome is basically the entire set of genetic material present in individual, present in a person. So we shows the variation, our genes shows the variation, okay? And you know that if we're talking about the metabolism of the drugs, this metabolism is done through the certain enzyme or a specific enzyme for the specific chemical compound. Yeah, and that enzyme is chemically a protein. Most of the enzymes are protein, okay? And you know that protein are coded by the activity of gene, your genetic material. Proteins are coded by, basically amino acid is coded by a different set of RNA, okay? A different set of RNA. So we have a variation in the gene, and that's why we shows different manifestation by using the same drugs, And this concept is called as the pharmacogenomics. This concept is called as the pharmacogenomics. Now, one modern research shows that this enzyme CYP2D6, which is present in the liver, it have at least 100 variants. How much? 100 variants. Means this single enzyme have the 100 variant, means 100 type of this enzyme is present in us. It means it will definitely show a different, you can say, speed of metabolism or different expression of metabolism. So it have a different function in our body. Now there is a two things which we have to understand. The one is called accelerated metabolism and one is called poor metabolism. If a person have accelerated metabolism, then person will suffer from something called as opioid toxicity. Fine? Two things we have to understand when you're discussing the pharmacogenomics. The one is called as accelerated metabolism or ultra metabolism. Ultra metabolism or accelerated. Fine. Another one is called as poor metabolism. Poor metabolism. If a person have such variant of this enzyme which make the codeine change into the morphine in a very quick way, person means have the ultra metabolism. Person will suffer from the adverse effect, the opioid toxicity. So the category B people have this adverse effect just because they have the variant type of CYP2D6 enzyme, which is responsible for changing the codeine into the morphine. That's why this person B have the adverse effect. Now coming to the person A have the disease, you can say the desired effect, means once it administered the codeine, and the purpose behind taking the codeine is for relieving from the pain, relieving from the pain, and after, you can say, using this codeine, patient have the relief from the pain. Fine. Now another category, a neutral category. Here what is happening? There's a poor metabolism. There's a poor metabolism. Maybe the enzyme, the type of enzyme, which is a very less, you can say, less potent to make the codeine into the morphine. Okay, this is maybe the less reactive. That's why the people have the neutral effect, or there's no any significant. They are not relieving from the patient. So whenever you are using the drugs, you have to understand the two things. Whenever we are talking about the pharmacogenomics, we have to understand the two things. The one is called as ultra metabolism. Another one is called as the poor metabolism. Now, the one thing we understood that just because we have the we have the variation in our genetic machinery, we have the variation in our genetic makeup, it means we shows, you can say, a different manifestation, different effect by using same medication. Okay, it means if we want to optimize the care, if we want to give the optimum, you can say, care to the patients, we have to specify the drugs for one particular category of person. And that's a very challenging and hard work. It is very challenging and hard work. Okay, and that you can say providing the specific drug to the specific person. This is something called as personalized medicine. This is called as the individualized medicine, or also called as the personalized medicine. Personalized medicine. Fine, no problem. Got it? This is something called as the personalized medicine. So this is about the pharmacogenomics. See, if we're talking about the present scenario, yeah, scientists are working to develop, you can say, a ways which is cost effective, easily accessible, and which is present for entire population, for all population. Okay, and it is very used. This is very useful because there are such organizations like the US Food and Drug Administration Department, FDA, and they are labeling certain drug. Okay, you know that as you've seen that there are different, you can say, the effect of a drug. Okay, effect of the same drug in a different person. It means we have to specify the drugs. So generally there are certain drugs called as allopurinol, okay, warfarin, anticoagulant. Okay, apart from that, we discussed the codeine, okay, and something called as the blood cholesterol lowering agent, somastatin. Okay, these are certain drugs which have the already, you can say, listed down by the US Institute of the Health, and generally in that category of drug, you see on the drug packet that they clearly mention that, and this is not useful for the 12-year, below the 12-year. This is not, you can say, recommended to use the 12-year, below the 12-year child, or for in the pregnancy times. Okay, during the pregnancy, doctor don't want to take the, you can say, risks, and they can use another alternative drug to have the less side effect and less, you can say, important. So this is about the pharmacogenomics. This is about the pharmacogenomics. Understood? No problem? Yeah, no problem? No. Now discuss certain another aspect of in the pharmacology, which probably you heard something called clinical pharmacology. Pharmacotherapeutics we already discussed. No. Now let's discuss about the clinical pharmacology. Clinical pharmacology. Okay, like the another term called as toxicology. I'm just describing the basic concept. Toxicology, chemotherapy and pharmacy. Chemotherapy and pharmacy. Now, you know that clinical pharmacology is a branch of pharmacology where we are basically using the drugs. We are studying the, you can say, the reactions in a person, in a man. Okay, clinically. It is about the clinical scientific study of drug in the man, and in the clinical pharmacology, and we've seen the two aspects. One is called pharmacokinetics, what our body does to a drug. Okay, another one is pharmacodynamics, what drug brings changes in our body. That's the two aspects of clinical pharmacology. Now coming to the toxicology. As you've seen the adverse effect of a drug, it means we have to also study the, you can say, the side effect profile of a drug, or adverse effect of a drug. Fine. You also have to understand that there is a, you can say, minimal range of the dose of a drug in which a drug is, you can say, work optimally. But if you overdose, it becomes the toxic. So same substance can be a drug or a poison depending upon the dose. Got it? So these all things are studied under the branch of toxicology. Under the toxicology branch. Fine. No problem. Now, another is called chemotherapy. Chemotherapy is basically, you remember The chemotherapy is used in the cancer, a malignancy, during the cancer or malignancy. Yeah. It's the one, you can say, the specific kind of drug category, okay, which we are using during the cancer times. Apart from the cancer, some other, you can say, the problems, some other diseases, okay, like some systemic infections, we are using this chemotherapy. There's some systemic infection, we are using the chemotherapy. Now, coming to the pharmacy, this pharmacy means it's a, you can say, another field of pharmacology where we are manufacturing a drug and dispensing the drug, distributing the drug, okay? And it, you can say, depends upon extraction, okay, identification of a chemical compound, then isolation, then synthesis, okay, and then standardization. So these are certain procedures which are discussed in the pharmacy. Got it? No problem. Now, coming to the drug nomenclature, you've seen probably that there is generally the three names are used in context of the drug. The three things are used, okay? The one is called, as, if you're talking about the drug nomenclature, write it down. Drug nomenclature. In drug nomenclature, you have to understand the three things. One is called chemical name. One is chemical name. Chemical name, okay. Another is called brand name or you can say the proprietor name, brand name, and another one is called as generic name. Generic name, okay. So same drugs have these three, you can say, a name. Three name. The one is called chemical name. Chemical name is basically based on their chemistry, based on their structure. Fine. So take the example of atropine, which we discussed. Okay, this name is it's a very long name, like 3-hydroxy, like this. There is a chemical name of the atropine. Now the brand name is go with the different brand. The one is called atropine, and this brand is also called as the proprietary, okay? Proprietary name or brand name is the same. Now the generic name is what? Atropine. Generic name is atropine. We are generally using the atropine. So remember, the same drugs have the three names. The one is called the chemical names. Another one is called as the Another one is called as the brand name or proprietary name, and another one is called non-proprietary name or generic name. Got it? So this is about the drug nomenclature. So let's summarize today's lecture. What we studied, generally we discussed about the introduction of pharmacology. We discussed that pharmacology is a branch of medicine. We discussed about the study of drugs, their interaction, how our body is responding. Okay, that's called the pharmacokinetics, and what changes a drug brings in our body called as the pharmacokinetics. That's the two most critical aspect of the pharmacology. Apart from that, we discussed about the pharmacogenomics, okay, how a drug is, you can say, related with our genome, with our genetic setup, genetic makeup. We also discussed the historical aspect, taking the example of beautiful lady, the belladonna. Got it? We discussed about the modern way that initially we extracting the drugs from the plant, and now we are preparing in the lab. That's called the synthetic ways, synthetic chemistry for preparing the drug. Then we discussed about the different other aspect of the pharmacology. We discussed about the clinical pharmacology. We discussed about the toxicology, where we are studying the adverse effect of our drug. We discussed about the chemotherapy, and we discussed about the pharmacy. And at last but not least, we discussed about the drug nomenclature, that one drug have the three name at least. The one is called the chemical name, another one is called a proprietary or brand name, another one is called as a non-proprietary or generic name. Got it? and here could be one another name, and that's the experimental, which we don't have to study. Okay, fine. So I hope you will study today's lecture. So thank you for having me. Bye. Have a nice day.